Hi, I'm Dave Watson and I'm the Secretary of the Socialist Health Association in Scotland, and I was until recently the Head of Policy at Unison Scotland, and I've been heavily involved in the development of care and integration in Scotland for many years. I'm going to give you a very brief outline of care integration in Scotland, what's happened and some of the positives and the challenges, which I hope will be helpful in your own consideration of the subject in England. The slides are in your pack, and the first one is quite a long slide on the history of care integration, which you'll be pleased to know I'm not going to set out in any detail. But I was once asked by the chair of the Health Committee when giving evidence to the legislation that set up our current system whether I thought it would work, and I referred to this slide and pointed out it's a very long slide. There is a long history of trying to get care integration off the ground in Scotland, not always successfully, and there's a fair amount of scepticism, I'd have to say, as to whether the current system is going to work as well. So the next slide you've got essentially is a chart from an Audit Scotland report, which gives you an idea of the sort of scale of health integration in Scotland. It's all adult social care, it's some children care as well. The model varies from local authority area to local authority area. There are essentially two models, although one model is only used in Highland, and in that model staff are transferred for adult care from local government to the health service, and for children's services the other way from health boards into local government. The other 31 local authority areas in Scotland with their health boards decided to go for what's called the Integrated Joint Board model, and I'll refer to a bit more to that in a minute. You'll also notice a key statistic there that, like many governments, there is a belief that care integration will actually save money, and there's a sort of target figure of £157 million in that. Needless to say, that's a somewhat optimistic view, particularly when you see from the same chart the scale of the challenges facing Scotland in relation to the growing need for extra spending on health and social care. The next chart gives you a breakdown of how our system works, how an integrated joint board works. It is essentially a joint board from the health board, representing the NHS, particularly community services, and the local authority, who largely deal with social care. Public health is still an NHS matter in Scotland, unlike in England. So the two boards present members to them, and they're joined by a range of people in that box on the left of the chart, and that chart shows trade unions, professional staff, and representatives from community and voluntary organisations. The key point about the structure is that nobody is actually employed by an integrated joint board, not even the chief officer. They're all employed either by the council or by the health board. The next chart, I've tried to summarise what I think are some of the positives of the Scottish system. Firstly, planning is not a dirty word in Scotland. We still believe in it. And the system is entirely based around both a national plan for health and care and local plans. And these plans have various different elements. I won't go through them in any great detail, but essentially there are plans around broad commissioning of services, plans for each locality within the local authority area. It's not uncommon in Scotland for health board areas which will include several different local authorities, and they'll essentially divvy up the care services. So one local authority might lead on mental health services, another on children's services, and so on. But they'll all have plans both for the integrated joint board and for the locality, and they drill down to individual service plans for the clients of predominantly the health board or the local authority. Another key feature of our system is engagement. You'll have seen from the previous chart that there's a wide range of bodies involved, including trade unions. That's not to say it's easy. There are big issues around the capacity to engage in this system. It's very complex. A typical integrated joint board meeting might produce an agenda of over 100 pages. And there are criticisms about how meaningful that engagement is for councillors, health board members and others. But nonetheless, there is a genuine attempt to engage a broad range of stakeholders in the development of health and care integration. Probably the biggest improvement is our procurement. In Scotland, we haven't got a tradition of great privatisation, but there is a difference in social care. Probably 60% is in the private or the voluntary sector, and about 40% in the local authority sector. The health services, virtually no privatisation in Scotland at all. So it's still predominantly a public sector led initiative, but there is a lot of procurement. Procurement has changed quite a bit in Scotland. We have our own devolved legislation, but it's still required to stick to European rules. The key changes, I suppose, are that whilst Scotland's does have to abide by the very constraints of European procurement rules, it has got a workaround for that, which has meant that in Scotland every single care worker should be receiving the Scottish living wage and be covered by what the Scottish Government calls its Fair Work principles. This is about things like trade union recognition, about limiting the use of zero-hour contracts. As we'll see in a minute, it's not always been successful, but nonetheless, there is a real attempt to produce fair work and deal with some of the employment challenges in the sector. Fair work, I should emphasise, is much broader than just pay. It covers a whole range of other issues as well. As a consequence, there's also probably a better take-up in Scotland of Unison's care charter, which obviously lays down higher standards than those elsewhere. And there is procurement standards set out in government guidance, which local authorities and health boards are supposed to abide by. So those are the positives. There are some challenges. Like everywhere else, but Scotland has an even greater ageing population than the rest of the UK. Real problems with long-term chronic conditions. You'll not be surprised, Scotland is not immune from budget cuts, and if you look at surveys by Unison and other trade unions, there are real issues about pressures on staff through workload and the pay, although better than England because the living wage applies, that's still not high enough to attract and retain the numbers and quality of staff that require. And morale is pretty low when you look at most of the surveys. The financial pressure is particularly urgent on social work. Local government has taken the brunt of austerity in Scotland, and therefore those services suffer. And as a consequence, the community sector, the voluntary sector and the private sector who provide many services have also struggled to get the funding they need to deliver quality services. We also have a real problem about fragmentation, particularly in the voluntary and the private sector. We have over 1,000 adult care providers in Scotland, which is far too many for a country of only 5 million people. This means there are very often very small organisations which struggle to manage. You don't recruit the quality and the scale of staff you need, and as a result, services do suffer. The question obviously is, does it work? And frankly, although it's only been going now a few years, 2 years in full mode, the evidence on structural integration of outcomes is pretty weak. The initial Audit Scotland reports are fairly critical. We're expecting another one in the next couple of weeks, which may be available by the time the conference comes out. But we'd expect that to say that progress has been made, but it hasn't been as radical as people had hoped. And really major organisational change has been a struggle. You can see that in evidence that the IJBs have given to Parliament in recent years, where they feel that the constraints of either the health board or the local authority not wanting to make the scale of change that some of the officials would like to see. Whether some of those changes are the right ones is another matter, but nonetheless that's where they are. One of the obvious statistical evidence that change is not radical enough is we still have a high level of delayed discharge, bed blocking in the common parlance. And in fact, very recently, the latest statistics are that there was an 8% increase in delayed discharges in the last year. So that's a good indication that things are perhaps not going as well as they might do. There's been, frankly, limited progress on workforce planning. And some work that I did on looking at the procurement system shows that health boards and local authorities in particular are giving insufficient weighting to fair work factors in procurement. We also know evidence recently from the voluntary sector providers that there have been delays in paying living wage, about 20% or so, 6 months after when it should have been paid, haven't done so, and these are about procurement issues at council levels where there is variation in the way that councils apply the procurement rules. And finally, there's very little monitoring of contracts, so we really don't know, particularly in the home care sector, how well those contracts are doing. So that's my overview. I hope that's been helpful. It's very brief. There are plenty of materials both on the Unison site and the Socialist Health Association Scotland site. SHA Scotland was involved with Unison and others in a major commission a couple of years ago looking at care, and we set out in that document how we think health and care integration should work in Scotland. It's a good deal more radical than the current system in Scotland, and you can download that from the SHA Scotland website as well. In summary, I would say that the system has the potential to deliver a better care and integration, but the challenges are enormous, and it's difficult to see how any structural change is going to address those unless we get out of austerity and deal with the real challenges, and the financial in particular, that health and care has. Hope that's been helpful. Hope you have a good conference. Thank you.